What is autism? Explaining the symptoms of autism spectrum disorder. What is autism? Did you know that autism spectrum disorder can affect the way a person learns and interacts with the world? Autism spectrum disorder, ASD, is a neurodevelopmental condition, a form of neurodivergence. ASD can cause differences in cognitive, social, and sensory functioning. As a form of neurodiversity, autistic brains can operate in different ways than neurotypical brains. As such, autism cannot be outgrown. Individuals can be supported, but not treated. Hi everyone, welcome to BetterHelp's YouTube channel. My name is Sonni Williams, LPC, a licensed therapist with BetterHelp. What is autism spectrum disorder? Autism spectrum disorder is considered a neurodevelopmental condition and form of neurodivergence. Neurodevelopmental disorders are a classification of mental health conditions made by the DSM-5, which is published by the American Psychiatric Association. Usually, when neurodevelopmental disorders are present, there will be symptoms and characteristics in a child's early developmental period. This period falls between the age of 0 and 6. There are also other neurodevelopmental disorders that researchers believe are caused by a combination of environmental and genetic factors. Other conditions include Fragile X syndrome, ADHD, and other forms of intellectual and developmental divergence. With ASD, the condition is marked by two main indicators. These indicators refer to what the DSM-5 characterized as persistent deficits in social communication and social interaction, and restricted or repetitive behaviors, interests, or activities. What are the symptoms of autism? Symptoms of autism can manifest in different ways depending on a person's age and sometimes gender. Symptoms of ASD are usually separated into two groups: social and communication symptoms and behavioral symptoms. Many people with ASD experience challenges with interpersonal interactions. Individuals may also have difficulty navigating social relationships. A person with ASD may use repetitive movements to self-regulate, which may be called self-stimulation or stimming. It's also common to have a specific focus or interest areas or follow a strict routine. Socially related symptoms. Based on the DSM-5 diagnostic criteria, socially related symptoms of ASD in adults may include difficulty with social interactions, understanding social cues, and challenges with back and forth communication. There may be a mismatch in verbal and nonverbal communication, such as smiling while showing disgust. Many people may avoid or have difficulty maintaining eye contact, showing emotions, and recognizing the emotions of others. A person may also be more likely to interpret language literally, making sarcasm, irony, and lies difficult to detect. Small talk may also be less compelling for someone with ASD. Sometimes the strain of socializing can lead to anxiety or exhaustion, and one may have difficulty making friends. However, researchers have found that when autistic individuals communicate with each other, they tend to interact as effectively as neurotypical people. These findings suggest that so-called deficits in some people with ASD may be contextually based. Other socially related indicators of ASD include atypical body language, repeating words and phrases, and behaving similarly in different social contexts. For example, one might speak to their boss the same way as they would a peer. Repetitive or restricted behaviors. Repetitive or restrictive behaviors may be considered a hallmark sign of ASD. These are behavioral patterns that tend to involve repetition, inflexibility, and restricted focus or interest in certain topics. For those without ASD, their interest or focus may also seem intense. Sometimes behaviors associated with ASD may also be considered inappropriate to the situation. Some examples of restricted or repetitive behaviors might include repetitive use of objects, speech, or repetitive movements such as rocking back and forth or hand flapping. These behaviors are also known as stimming. Due to the sensorial differences in those with ASD, many people either respond strongly or don't respond to certain stimuli such as sounds, sights, or smells. It's also not uncommon to be fascinated with lights, spinning objects, and other visual stimuli. Inflexibility characteristics may manifest as challenges with life transitions, such as moving away. A person may also exhibit rigid thought patterns and experience distress at sudden changes. Many people also have ritualized patterns of behavior, such as walking back and forth several times. One may also have a strong desire to keep a personal routine and insist on following fixed routines. Echolalia, which involves repeating certain words or phrases over and over, may also be common. How do I know if my child is autistic? ASD is often diagnosed in early childhood, a time when challenges with social relationships become more apparent. Depending on a child's age, different symptoms may be more pronounced. In younger children, they may not respond to their name being called. In older children, adjusting to the rules of games like make-believe may be difficult. According to the CDC, some possible indicators of autism in children include a lack of facial expressions, repeating words or phrases over and over, getting upset by minor changes, not noticing when others are upset or hurt, playing with toys in the same way without variation, obsessive interest and less usual reactions to the way things smell, taste, feel, or look. Support can come in different ways depending on a person's requirements. Remember, ASD exists on a spectrum, but symptoms can affect the way a person interacts with the world. As such, autism can be a condition that can be equally celebrated and supported. If you like this video, go ahead and give it a thumbs up. You can also subscribe to BetterHelp's YouTube channel for more information, insights, and tips on mental health. Thanks for watching. See you next time.